We on or?
Okay,
We are ready.
Dr. Carey, we can see you.
You can, okay. Thank you. All right, so we have a 30-year-old female here for injections. She's really perfect. I don't know where, I'm trying to find places to inject in her, but she's got a very pretty face. So we're going to kind of look at her and try and figure out what we could do to make her a 30-year-old, add some features to her. She's already got great cheeks, but I know that in Ukraine, Russia, that we'd like to have a little bit more, so it's a little cultural thing. But I could definitely see that, for example, when we look here, that there is a little bit of hollowing here. But I want to be very careful about putting more filler because of she already has great cheeks here, okay? So this is why for example, that technique of going deep and superficial is excellent, because we can use a very small amount of material to kind of get that shadow out. And what I'm going to use in her, I'm going to use the RHA 3 here because of her age. And instead of using my usual ratio of 2/3, 1/3, I'm going to probably use half and half, because what I want to try and do is to lift up that little bit there in the superficial component, but not with a lot of material. Then what I'm going to do is I want to try and just put a very small amount of material just to give her the impression that there's a little bit of an elevation here, which will give an added feature. We can certainly do something about here. We can normally, if we're putting more volume here, this will tend to fix this. But as that's not the case, we're going to use a little RHA 3 here. And you can see that she's got a little bit of a wrinkle line here, so I may inject RHA 2 in that particular area. The other features that I think that would make a really nice difference for her, I'm going to turn her to the side, is we see that her upper lip projects over the lower, and the ratio is not the best. Remember we said 1 to 1.6. So what I'm going to do is I'm just going to close your mouth. We want to kind of give her this for a lower lip, to just give her a little more volume. And the other thing I was just noticing on her was that there's a slight asymmetry, and you can see that she's got a little bit of jowling here, but this side is really very nice, okay? And so, in fact, this may be partly due to the fact that she's got a little atrophy. If you can get down in there with the camera, we can see that this side is a little depressed compared to this side. So we're going to look at putting a little volume just on the left side of her chin here. And as I mentioned before, she's a great case for, you see how I can bring that at the mandibular ligament, I can really pull it out. So she's a great case for doing, just putting a little there to make that a nice straight contour. So that's my plan today. And the other, if we have time, we may look about putting a little bit of volume in her forehead. Let's see if we can see that. There's just a little bit of hollowing here at this area. So again, remember that we said 1 centimeter above the brow. Okay, so we want to stay above that line here to prevent hitting any of the blood vessels. So this would be the area that I'm going to inject in. If I wanted to get some of the material here, I could try pushing it down a little bit. The other thing that I'm going to probably try and do with her is just to give her, you see that her fat pad above here is a little bit deficient. However, she's got a very prominent brow here, so you don't want to make a big, huge elevation there, because it's going to accentuate it. But it would be nice if we could just get this little bit of change that you see above here to create a little bit of a light reflex. So I'm going to inject a little bit of the RHA 3 here. So I will do this before I do this, because once I inject here, I won't see how much I'm going to put in there. So we'll start with the, and I'll just get a dry gauze. Thank you. So you can see that I have, the patient is actually sitting up in front of me, and what I'm going to do is I've got the Teosyal pen on the continuous flow, and I've got the RHA 3. So again, so what I do is, I'll have you look, is that let me just borrow the pen for 1 sec again, just the pencil.
Okay.
So just remember that there's the mid-pupil line right here, that just medial, in this area here is where you're going to find the nerve and the artery, okay, it's sort of it's between the pupil and the limbus. So if you inject at between here and more towards the limbus area here, you're going to be in a safe area where you're not going to hit a blood vessel. So I'm going to take a gauze, dry gauze, please.
Yes, of course.
So you remember that I said that once the needle is primed, you see this needle has a material in it. There's no point at all of trying to withdraw the material, because even if you were in a blood vessel, you wouldn't get it. So what I do, my technique is that I like to put a cushion. I like to bring up the tissue a little bit, and I use this hand here. I use this hand here to stabilize. Rest my hand on there. Okay, un petit, a little pinch, and we're in. I'm down on the bone. Okay, so I'm injecting 0.1. And now I'm going to bring the needle up a little bit. Okay, so you can see that if you can come around with the camera, can you come around with the camera just to show that? I'll try and move this in. Just turn your she turns her head a little bit. Okay, so now I'm a little in the superficial component. I'm going to inject actually a little bit more in there than I would normally do. Okay. And we just have a look. So then, this is the big advantage of needles, I find, is that I can see exactly. Can you back up back up a little bit? All right. So we see that I can still have a bit more room to go. So I'm going to put a little bit more in. I'm going to go superficial. I think this battery is dying, actually. So again, one of the things is that I'm not pressing the material down. I'm just sort of holding my finger so that there's no bleeding. So I'm not trying to massage the material out. Okay. So we can start to see that you can see that the depression is less here than on this side. So now I'm going to go over here and just pick an area. So what I usually do is I go about a half a centimeter from the lateral commissure. I go a half a centimeter here, and then I go down here, and I find a point that I want to raise up. So I'm going to go right here. I'm going to inject a little bit. Okay, listen, I think we're going to need to switch. I'm going to take the other pen, okay?
The battery, maybe?
Yeah, or you have the, I have the battery. So we're just going to have a quick technical fix here. Okay. Okay, let's see how that works.
Okay.
There we go. All right. So we're back in action here. All right, so we're going to go back in here, and we're going to put a little... We're down the bone. Now I'm bringing it up. Okay. So we're just giving it, okay, can you back up the camera so that... Yeah. So we're just kind of giving her a little highlight in this area here, all right? So that's about all I'm going to put in there. I've put in 0.2 mLs of material. So not a whole lot of material. So let's go now, while we're here, let's go down to the nasolabial line. So you can see one of the other things I do is I bend the needle up a little bit, so it just facilitates that.
It's okay.
Yeah, okay.
They can see.
All right. So let's start, we're going to start at this area here, and then I'll work my way down actually. So I'm going to pinch here a little bit and down. As you remember I told you about going, this is we go down and I inject, and then I stop. Now I go into more of a superficial plane and inject as I'm coming down here, okay? So already we're starting to lose, we're softening that area up. Again, we're going to go here. So I like the pinch down and injecting as I'm pulling out, stop. go superficial now, thread through, and inject as I come down. And you can actually see a little bit of the elevation as we go there. So now we've almost softened that angle up there. And so now what we can do is we'll just finish off that last little bit of a line. You see this line when I bend here? Now this, you could either use the RHA 2, which is a perfect thing. You could be a little higher up. So I'm going to have to go a little bit deeper, and I'm just going to kind of go on the superficial plane and inject as I come down. So we squeeze that. All right, let's get a cloth to just clean that up, please.
Wet, yes?
If you had a wet one, yeah.
Yes,
So let's turn our
please.
head. Yeah, thanks.
What was
All
the
right.
product?
Which one?
What was the product?
That was RHA 3 that I used there. So you can see that's considerably softened up, and we've again just used a very, very small amount of material. I'm down to so I used probably 0.2 mLs to correct that nasal labial line. So let's actually move over now to her while we're here on her chin. So as I mentioned that this is a little atrophic here. Again, do we have the RHA 4 on?
Yes,
Yeah.
of course. Should I give you?
Yeah, I'll just, or actually, I'll tell you what. Yeah, let's take the 4. And we can put that on the other. Why don't we'll put that on the other pen. And in the meantime, what I'm going to do is I'm going to do her at the area of the ligament. Okay, so we can see that I put the mark that this is where I see it as the maximum depression here, and so. What you can do, the nice thing about the 3 or the 4 compared to when I used to use Ultimate here, was that sometimes with the Ultimate you would have a little bulge if you put a bit too much in there. And in this case you can actually go a little more superficial. So I'm going to actually try, just turn your head okay, so we're going to kind of grab it up here. It's a little hard where I'm positioned here. Okay, so we're going to kind of go in here. Can you see? There we go. So we're deep, and we're going to put a little injection. I'm going to kind of do little drops in there. I'll pull it out a bit. And I don't know if you can hear the sound of the material. So we'll bring that back. And so already just with that little bit of, can you bring your camera down a bit? So with that, we've almost made that mandibular notch disappear. So now I'm going to take the 4. Yeah.
A battery.
Which one? Oh yeah, the old battery. Yeah.
Okay.
Yeah.
Thank you.
So we're gonna what I like to do for when I'm injecting the deep in here is I'll kind of pinch, and we're just going to go straight in, or if you're using a cannula, you could come in from the side here. But we just want to give a little more projection on this particular area of the chin. So while we're waiting for that, let's move up to the. Can you come up here to the eyebrow?
На бровь.
Okay. So we're going to do the brow here, and again, what I want to do is to try and just get a little bit of the light reflex here, and you can see that when I press down on there, that you can see a little bit. This is the area that we're going to try and concentrate on, right into that area. Okay, so all right. So what I do is I start just at the point of the brow here, and I've got the needle bent at around 30 degrees, so that when you go in and go this way, you will go basically along the bone area. Okay, so you can pick this up, go down deep. Okay, so again, the beauty with the needle over the cannula is I can see exactly what's going to happen as I inject. Okay, so we're going to inject as we go out, and just stop a little bit before we get to the edge. Okay, and already, and it may be a little difficult for you to see, but we're starting to get a little bit of an elevation of that, and then we can go over here again and down as we inject. So this has two features that it allows. One is that it gives you the light reflex. But on the other thing is because this product contains lidocaine, as it actually will work like a toxin. So it will work like your toxin you use in your office, so that after you finished doing the injection, usually what I do is I show the patient with a mirror, because the anesthetic in here will actually tend to lift the brow up of the patient. So we'll see if that's the case. In fact, it actually is starting. If you back up a bit with the
Назад камеру, назад.
back up with the camera.
They can see.
Yeah, I know, but I can't. I don't know if you can see. Can you get there? Okay. So we can see that brow is starting to go up a little bit there, just from the thing. So you can then show the patient what a toxin will look like. What kind of results can they expect with a toxin? So the other interesting thing that I just found recently is that I was studying the eyebrows of patients, and patients like her, naturally very high eyebrows, actually seem to have a weakness of not being able to basically bring their brows down, so they get this unopposed lift here. All right, so do we have some of that 4?
Yes,
We have to switch
okay,
we have to switch batteries?
Yes.
Okay, let's do that.
No, switch the batteries, maybe change just.
Which one? Okay. Oh, I see.
Коллеги, если у кого-то есть
Oh, I see.
вопросы,
Okay, okay.
пожалуйста,
We're just
давайте спрашивать. Есть у кого-то вопросы?
actually let me do it with yeah, because I'll have to pull that thing back. Let's do it with a 3 here. What was there was a question there? Was there?
Пока вопросов нет.
What's that?
No question.
No questions.
No
Okay,
question,
10 minutes.
yes.
Okay. All right. So listen, let's go into the chin area here, and then I'll try and actually I want to do the lips before we finish. So we're just going to go in down to the bone, and we've emptied the syringe in there. And we can probably put a little bit more, but we're already bringing this down. Okay, so let's switch that out, and I'm gonna take another 3 because I'm gonna do her lips
3
now.
now.
Okay,
Okay.
so I'm gonna have you lay back. Sorry. Thanks.
So,
Can I have the head of the bed down a little bit? Can we bring this down?
Minus, Kuba. Can I?
Yeah, sure. Thanks.
Thank you.
So in the next 10 minutes, what I'm going to do, I'd like to do is to show you again the lip injection, and also I'm going to just do this area of her forehead for her. Yes, perfect, yeah, great. Okay, so again, what you want to do is, as I think you can see here, that fact that the ratio of your upper lip is about 1.2 to 1. So we want to kind of bring this down, and you see that what we want to do is basically have a pillars of material pushing this lip a little forward here. So we're almost ready here.
Yes.
Yeah, natural. Everybody's worried nowadays of having unnatural lips, so this is a very nice way to give them a good look. All right, so let's have you turn your head this way. Okay. So, and a gauze, please. A gauze? Gauze.
Yes.
So again, just take a really beautiful lips are where you have almost a couple of little nodules on either side. So the simplest way is to have the patient, you just, there's a mid, let's take a pen, please, if I can just have that for 1 second. So you can just sort of lay your needle across here, and you see that that's the center of her lip, okay? And what you want to do is you want to fill between that area, just kind of from here to there, and from there to there roughly, okay? So again, so what I do is I grab the lip, I pinch it up like this. So I've got it pinched so that the needle is lying horizontal, okay? So we're essentially going to go all across like this, okay? Each time as I roll the lip, I'm going to be into a different spot, okay? So here we go. So we're going to just kind of go right in I go in dead center there, and we're injecting as we're going, coming and going. So I'm just rotating it. So you can actually, the nice thing again of having my fingers pinching that area is that you can actually feel the material pushing against this, which tells me that how much stuff I got in, okay? So there we see that we're now close the mouth, and you can already start to see that lip is fuller, but it also looks totally natural. So let's go on to the other side. And again, I'm really going to undertreat this patient because she's very concerned, and so we're just putting a little bit of material in there. Again, deep. And we stop. How are we doing for time?
Со временем как у нас?
Close your mouth. Close your mouth.
5 minutes.
So look at, I don't know if that, yeah. So there we're almost got the ratio of 1.3 to, or 1.6 to 1. Okay. If I hand her a mirror, she'll have a look. She'll be more reassured. Do we have a mirror for the patient?
Yes.
Yeah. So just so that she feel you have a.
Наташ, берите, пожалуйста, зеркало и посмотрите на себя. Зацените результат.
Yeah. So we got a nice smile. So, you know, we know that she's happy with the results. And so I'm not going to, you know, again, the patient expressed a fear of not wanting to look like she had something done. So I'm going to be very, very conservative with her. So I see that there's just a slight imbalance on this side. So I'm going to add just a little bit more here. Okay, and we're going to call it a day on her lips. And you can always go over on this area here to bring it up a little bit more to fill that in if you so wish. But I think that, just close your mouth. Yeah. No, for me, this is a very nice look for her. She'll get used to that, and we can always have her come back and do that another day. I'm going to just change needles here. And we're going to, we're going to go to RHA 2.
$30G.
Yeah, 30G, and so we're going to go to the forehead. Again, so we see that there's a little bit of a depression in this area here. Now, the one thing I'm going to tell you that the first time I ever did this, that the patients can be very bumpy afterwards, after you do it, particularly if you're doing it with a needle. And no matter how much you massage, the bumpiness will not go, but the next day they will look fine. So don't be nervous if they happen to leave the office and they don't look particularly good. What I like to do, as you saw in the videos, I like to sometimes inject against my finger. So I put the needle through here, my finger is on top, and I press as I'm injecting so that I can kind of push the material along and have a nice smooth pattern there. So we're just about ready to go. All right. So again, you certainly can, your cannula makes total sense here. If you're going to do it with a cannula, what I would do is I would enter here with your point, and you could just sort of feather along that particular area here. Until you filled in that area. Okay, so we're ready.
RHA 2.
Yeah, good. Okay,
Yes.
so I'm now using the RHA 2. I've got the pen on the rapid, on the continuous flow. And so what we're going to do, we're going to pinch that, we're going to try and pinch your skin up, okay, so that you know where you are. And we're going to go deep. Okay, so my needle is deep. And so now I'm going to press. And you can feel the material come against your finger as you're injecting, and then you can pull back and move it around a little bit. Again, you don't need very much stuff here. So we've injected 0.1 ml at the present time. Okay. And now, because I'm using a relatively short needle, it's only a centimeter, I'm going to have to do a second entry point. So that definitely is one of the advantages of using the cannula. You can have a much longer cannula. So you can see that there is an elevation here. You have a nice smooth elevation. There's no bumpiness there. So I'm going to go up here now, and we're going to go deep down, and then bring the needle flat. inject in the center. It's again 0.1 that I've injected, moving the needle along. And again here. So we've injected so far a total of 0.4 ml, 0.35 mLs of material, and we're finished. So I think that's just going to sort of smooth that out a little bit. But you can see that now we've got an elevation, and we really don't have any lumpiness with that. And that's one of the reasons I like the pen here, is that I can really, I don't have to, it's easy to inject whatever position you're in. You can be like this, you can be like this. You know, if you're with a plunger, you can only do it in certain positions. So I think we've hit our time, have we? Vlada? We're time out. Okay. So thank you very much, and is there any questions? Yeah.
Уважаемые коллеги, если у вас есть вопросы, есть?
Da? What was that?
Wait a minute.
You will go to the audience
Ah.
and we will prepare.
Okay.
I will inject
Okay.
until it continues.
Okay. So I go to the audience now, or? Okay. I need to finish her. I'll finish her up afterwards, or? Okay.
Please, if you would like to correct the second lip, what kind of technique would you
Можете пока
use?
закрыться?
If I was going to inject what?
The upper.
Upper lip, okay. So what I would do in her, again, I have a personal bias, okay, that I don't like injecting along the lip edge, particularly in older women, because they're atrophied here, and then you bring this up. I don't want patients to look like they've done anything, okay? If you look at her lip right now, you would say she's had nothing done to her lip. So what I would do if I was going, just open the mouth, okay. So if I was going to inject, can I get a pen, please? Yeah, there's a pen, no, sorry, the ink pen, pencil, yeah, and also a gauze, I'll just, So if I was going to do some injections of her upper lip, what I would do is that I would take my finger like this, okay, and you can see that this is the wet line here, this is the dry line, this is the dry area here, and can you see that? Okay, so just open the mouth, okay. So along from this point here, I would take my needle and I would thread it there and inject as I come out, okay? And then I would come down to here and I would inject a little bit more if I needed to. So there, you see all kinds of different ways. You'll see people going, I know that my friend, Jean Sebag likes to go this way. He goes right through and injects. You can get to this point by different routes, but I find that this is just a very simple thing where you can inject, you stop, I look, I see if I'm happy with the results, and then I move on. So that's my way of doing upper lips. Again, I don't like going through here. You see some people will tend to inject along this area here as well. Again, I find that this gives you volume. This gives you volume, and it also at the same time gives you a natural looking lip for somebody of this age.